Hi, this is Irma coming back to you again. I am continuing my series regarding a journey with Anaplastic Astrocytoma that our son was diagnosed with at the age of 8 in the second grade. I recorded this session before, but it didn't do so well, so I am having to record it again. Last week, I came from sunny California, Woodland Hills, and I was out there. I did my video in the whirlpool. I'm back in my home state of Georgia now, so I'm coming to you from a different location, but I'm home, and I'm better. I did have allergies. I normally don't have allergy problems, but because I guess I was in a new environment, not used to the dry climate and the pollen in the area, I developed allergies out there. So I'm a whole lot better now. Still have a little coughing, but I'm getting better each day. When our son was diagnosed with anaplastic astrocytoma, after the resection of that tumor, there were several um, other diagnoses that he had after the resection, post surgery, and one of the biggest thing that we had to deal with was the fact that our son had a tube in him. In fact, he had two tubes. He had a trach, and it was placed in the trachea here in the throat in this area, and the main objective of that trach was to help him breathe. So he was breathing mostly from this location and not from his nose or his mouth. So we depended heavily on the trach for his breathing, and I had to learn about trach, and I also had to learn about oxygen. I had to learn how to care for the trach, how to change the trach, and how to keep him keep that procedure sterile. So this, I have the trach with me. I have a bag of trach. I actually kept all of the trachs, most of the trachs that each week we changed the trach. This is what a trach looks like. This is a pediatric trach, and trachs usually come with what we call a stem and the trach. This is the stem. So the doctors determine if your loved one, your child needs a trach, and they insert it. They make an opening here, and they insert it in the throat, and the stem has to come out so that they're able to breathe. The trach also has what we call trach ties to hold it in place, and it fits around the neck, such as this. But this part is inside the throat, and the stem is off. I had to learn how to insert the trach and change it in and out each week. So, and then I had to learn how to suction. There's a device that goes in there to suction the mucus in the trach so that your loved one could breathe better. Each week I changed this trach out, and I always had a nurse to be there to assist me, because I always told the nurses that this was a two-person procedure and that they did not ever need to change the trach without my presence. Each time when uh, most of the time I changed the trach, and the nurse was there to assist in case there were any problems. I did have a nurse, which was one of the primary nurses. She 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 would change it sometime with my being there. Um, there were occasions when lots of times I changed the trach by myself in the middle of the night. There were times when there were emergency situations, and I needed to change the trach before the week was up. Lots of times when that happened, there was a blockage in the trach, and I could not suction it out, so I needed to do change the trach in the middle of the night, many occasions. So this is what our son wore for 10.5 years. He had a trach to assist him with breathing. At night, the trach was covered with a mask, and he was getting oxygen to assist him in breathing throughout the night. And also, the trach needed to be moist, to have moisture, because when we breathe on the inside of us, we have moisture, but this trach is a tube, and tubes get dry. So there was a cover for moisture that would pump moisture so that it would be easier for him to breathe um, air. I cleaned uh, under the trachs. I used the long Q-tips, the long stem Q-tips, and cleaned under the trachs where the trach was on my son each day, and wiping away from the, the stem of the trach, or the trach itself. I'm sorry, wiping away from it and keeping everything as sterile as I could, as clean as I could. So, and then the trach ties. Um, Lots of times, if I didn't have more ties, this has Velcro on it. I could take it out and wash it with warm soap and water and let it dry and reuse the ties. Like I said, each week I got a new trach, so I didn't have to reuse this one. But if I had to reuse a trach, all I needed to do was put this in warm water and soap and wash it out. I had a brush that would go in and wash it and rinse it and let it dry and reuse it. Um, but I was fortunate that the insurance company paid for me to get a new trach each week. Each one of these trachs back then was $120 each. So I didn't throw them away. I kept them. Excuse me, I bent down to get a bag. I just want to give you an idea about how many trachs I have. 10.5 years of changing trachs. I kept them each week. And my bag is this big. I'm sorry if this is getting dark, but these are all trachs. So I have some experience in changing trachs each week, or emergency changing of trachs for my son. And like I've said earlier, after my son had the surgery, after the resection of the tumor, my son was not able to walk or talk any longer. He was not paralyzed. He was paralyzed, but only for about 4 weeks. And the paralysis on his left side went away, thank God. But he was not able to talk any longer, or nor was he able to walk. Like I said, the trachs I used on him initially, because he was 8 years old, was the pediatric trach, and trachs come in different sizes. And this trach, the name of it is a Shiley, and it's a 4.0 peds, and peds mean pediatric. If a child is about ready to be decannulized or have the trach taken out, um, we would try using this little instrument on him, this little device. It is called a passive mirror. It fits over the trach and it forces the child or the patient to breathe more from his nose. And if he's able to do that successfully without his oxygen levels dropping, without him desaturating, then um, that child is ready to start the process of being of coming off the trach or being this trach being decannulized. So they this passenger is used for that purpose. Uh, and saturations, I will explain that briefly. Everyone oxygen level, every human being oxygen level should be between 90 and 100. 90 is on the low end, and 100 is on the high end. It's on the good end. So if you're at 90% oxygen in your body, um, it's low. If it drops below 90, you are going to need some oxygen. So sometimes, even with the trach, Sean's oxygen level would drop below 90. It would be sometimes 86, 84, and then I would have to give him oxygen. I learned how to operate the oxygen tank and how to give him oxygen, how to know when to how much oxygen to give him and when to level it off because people can become oxygen dependent. So I had to learn all of that. I learned it at the hospital, and some of what I learned was from nurses who came to the house to help me take care of Sean. So um, so that is about all that I need to say about a trach. Medically, the doctor determines if a patient needs a trach or not. And at the hospital, they are the ones who initially does this procedure. Um, the primary caregiver of the patient may learn how to change out a trach and how to put the trach back in and how to care for a patient with a trach. It is a very, very sterile um, procedure when changing the trach in and out. And one needs to wear gloves and one needs to know exactly what they're doing because the person you're changing this trach with, their life is in your hand when you're doing this because when you take that trach out, their oxygen, their breathing, their method of breathing is not there and it needs to be done quickly and it needs to be done properly. So I I am not a nurse and I am not a doctor. I'm only a mother who had to take care of her son who had two tubes, a trach and also a feeding tube, which I changed out the feeding tube every 4 months unless there was a problem that I had to do it um, for an emergency purpose. But I did learn how to do all of those procedures uh, to take care of my son at home, which caused me to not have to run to the hospital every time there was a problem. Oh, okay. I think that's all that I needed to say about this little fellow, trach. Uh, Tracheotomy is the procedure that was done to insert the trach, and the trach is spelled Trach. And hopefully, this video was helpful to someone who is going um, through this. I do sympathize with you if you're having to uh, have a trach with a um, have a child or a loved one who has to have a trach, um, it it means that they were very, very ill, and I hope that they will not have to utilize a trach for very long. It is a long-term tube, and people have um, had these tubes in their bodies for years, 10, 20 years. 20. One nurse told me that he had a patient who had a trach for 27 years. So it is a tube, and tubes are sitting ducts for infections. So it's imperative that you keep um, around the stoma. The stoma is the hole where the trach was inserted. So it's very imperative that you keep around the stoma clean, and the doctor will check from time to time. The pulmonologist will check from time to time to see if there are any granulations. And granulations are things that is a buildup of tissue where when you put in the trach, it makes it difficult to go in um, properly. And when a person is um, uh, well, I won't go into all of the details, but I'll just say this: the person who is having to care for their loved one with the trach will definitely need training in how to take care of trach and how to change a trach, and they will need training with oxygen because people who have trachs, from time to time, um, their saturations drop, and they will need oxygen. So they will need to be well trained and providing care for their patient or their loved one who has a trach. Okay, I hope this video has been helpful. Thank you so much, and have a great day.